During the examination, the nurse is going to start with the sensory function first. It is testing the ability to feel touch or pain on the face. The patient's eyes should be shut, and use a cotton ball to touch each side of the face along the forehead, the cheek, and the chin. You want to ask the patient if he or she felt any touch at all, or that the touch should feel the same on each side. Next, you're also testing the corneal reflex. You want to touch the cornea at its junction with the sclera. Next, test the motor function. You want to observe symmetry of the face, and make sure the mandible point is midline. Ask the patient to clench his or her jaw and palpate the masseter and temporal muscle. Next, ask the patient to move his or her jaw from side to side against resistance of the clinician's palm.
Hi, I'm Sarah. I'm going to be your nurse today. Can you state your name and date of birth for me?
Diana DeBernardis, 10/30/95.
Okay. Today we're going to do a neurological exam. The importance of this is to identify any abnormalities in your cranial nerves and just make sure that everything is functioning properly.
What is the fifth cranial nerve? It is the largest cranial nerve out of all 12 nerves. It has sensory and motor function. It is split into 3 divisions: the ophthalmic, maxillary, and mandibular. Its sensory function supplies touch, pain, and temperature to the face. The innervation includes the cornea and conjunctiva of the eye, mucosa of the sinuses, nasal and oral cavities, and the dura of the middle, anterior, and part of the posterior cranial fossae. Its motor function supplies the muscles of mastification. These muscles produce elevation, depression, protrusion, retraction, and the side-to-side movements of the mandible. This picture shows cranial nerve 5. As you can see, it branches off into 3. The first is the ophthalmic, second is the maxillary, and then third is the mandibular, which controls the bottom jaw.
Today, the nerve that we're going to be testing is the trigeminal nerve, and that is responsible for any sensory sensations of the ophthalmic, maxillary, and mandibular areas. And it's also responsible for motor function and some sensory functions all over your face. The first function that we're going to test is the motor function. So if you can open and close your jaw, the temporomandibular joint seems to be functioning good. If you can clench your teeth, okay, good. Here. Clench your jaw. Now the sensory part that we're going to test, I'm going to just have you close your eyes and tell me when you feel me touch your face, okay? So you could just say now, whenever. Now, 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 now. Okay, good. Now if you can also just tell me again when you feel me touching your face. Now, 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 now. Okay, everything seems to be normal. So I'm going to test your corneal reflexes now. You're not wearing any contacts, correct? Okay, if you could just look straight ahead for me. Okay, everything seems normal. So all the findings in the assessment today came back completely normal. Everything's functioning optimally. But in the future, if you ever notice any problems chewing or with sensation in your face or anything like that, just call your doctor right away because it most likely is a problem with an impairment of the trigeminal nerve.
One abnormal finding of this cranial nerve is called trigeminal neuralgia. This is the most common abnormal finding. It can be idiopathic, but is often caused by compression or injury of the nerve root. This pain is unilateral and tends to involve the second and third division, which would be the maxillary and mandible. This pain can be intense enough to cause patients' face to grimace. Another abnormal finding is called Sturge-Weber syndrome. This syndrome is a neurocutaneous syndrome that is characterized by facial point line stains in the trigeminal nerve distribution, plus open-angle glaucoma and vascular lesions in the ipsilateral brain and meninges. The syndrome occurs sporadically and with equal frequency in male and female genders, and probably is due to mutation during embryogenesis that is called a disruption.